Every year, new health concerns make headlines, but every once in a while, a virus catches us by surprise. Right now, a virus is rapidly spreading across China, and it's raising alarms worldwide. Human metapneumovirus, or HMPV. While you may not have heard of it, this respiratory virus is causing a lot of concern. What exactly is HMPV? Why is it becoming a bigger issue now? And should you be worried? Let's talk about it. HMPV was first discovered in 2001, and it belongs to the Pneumoviridae family, close cousins of the respiratory syncytial virus, or RSV. Though it's not a new virus, many are just beginning to learn about its potential impact. HMPV primarily affects the respiratory system, leading to symptoms similar to the flu or the common cold, but it can also cause more serious conditions like bronchitis and pneumonia. The virus typically spreads through droplets when someone coughs, sneezes, or even speaks, and it's a year-round threat, though its impact tends to rise in the cooler months. Over the past few weeks, China has seen a significant surge in HMPV cases, especially in larger urban areas. The rise in cases has prompted hospitals to respond to an influx of patients showing respiratory symptoms linked to the virus. Some experts suggest that this sudden uptick could be due to a combination of factors: changes in seasonal weather patterns, increased travel during the holidays, and even a lack of immunity in the population, which may have been affected by years of pandemic-related restrictions. China's health authorities are working diligently to control the spread of the virus. They're urging residents to take preventive measures, such as wearing masks and practicing social distancing. However, this outbreak has sparked an important question. Why is HMPV emerging as a public health concern now? The virus spreads in much the same way as other respiratory illnesses, like the flu or COVID-19. When someone infected with the virus coughs, sneezes, or even breathes, tiny droplets containing the virus are released into the air, where they can be inhaled by others. Additionally, touching surfaces contaminated by the virus and then touching your face can also lead to infection. Now, what are the symptoms? In many cases, it starts like a common cold: fever, runny nose, and a sore throat. But it can escalate into more serious conditions like wheezing, coughing, shortness of breath, or chest pain. The elderly, young children, and those with compromised immune systems are especially vulnerable. Severe cases may require hospitalization due to complications like pneumonia or bronchiolitis. While HMPV shares some similarities with COVID-19, it is important to note that it's not a new virus. In fact, HMPV has been circulating for over 2 decades. However, the symptoms, fever, cough, and respiratory distress, are quite similar to other common illnesses like the flu, making it harder to differentiate without proper testing. One significant difference is that while COVID-19 has a higher potential for widespread global outbreaks, HMPV doesn't seem to spread as rapidly. But that doesn't mean we should ignore it. Its ability to cause severe illness in vulnerable populations means it's still a public health concern. Though HMPV is currently concentrated in China, there's always the potential for international spread due to the interconnected nature of our world. With millions of travelers crossing borders every day, viruses don't stay put for long. If HMPV begins to spread to other countries, especially where people's immunity to it is low, we could see localized outbreaks. Health organizations like the WHO are closely monitoring the situation to prevent this from happening. At this point, the key is early detection, monitoring, and prompt action to contain it. Practical steps you can take to protect yourself and others from HMPV and other respiratory viruses. Here's what you can do. Wash your hands frequently with soap and water for at least 20 seconds. Avoid touching your face, especially your eyes, nose, and mouth. Wear a mask in crowded places, especially in areas where the virus is circulating. Practice good hygiene. Cover your mouth and nose when coughing or sneezing, and use tissues or your elbow to prevent the spread of droplets. Stay home if you feel sick to prevent spreading the virus to others. And of course, if you experience severe symptoms such as difficulty breathing or chest pain, don't hesitate to seek medical attention. While the recent outbreak of HMPV in China is concerning, it's not a cause for widespread panic. The virus is manageable, especially with the right precautions in place. Healthcare workers, scientists, and health organizations around the world are on high alert, working to ensure the situation is contained. For now, staying informed and following simple health guidelines will go a long way in keeping you safe. Keep an eye on updates, and don't forget, prevention is always better than cure. If you found this video helpful, please like, share, and subscribe for more updates on global health and current trends. Stay safe and take care of yourself and those around you.